Hello everyone and welcome to my channel. This is Dr. Tidman. Thank you for stopping by to view this brief presentation. This is the first in a 5-part series of how to interpret your blood work or Bloodwork 101. I'll post this video and then the next parts will be posted every Monday after that. So I've been posting videos every Monday. So be sure to like, subscribe, and hit the notification bell so you'll be informed when I post the next video. Remember that these presentations are for informational and educational purposes only. It's best to consult your own medical team if you have a question about medications or changes you'd like to make. My background, as you know, if you've seen these reviews and presentations before, is I'm a metabolic health practitioner and the director of clinical research for the Colorado Parkinson Foundation. Since 2018, I've been conducting studies in Parkinson's disease. But more recently, I'm also conducting studies in metabolic health and a special study being recruited for right now in osteoporosis. So today's video, again, first in a 5-part series, is to review common metabolic health markers. Today's video is about a CBC and a CMP, so that's a comprehensive blood count test and a comprehensive metabolic panel. And many of you have these done every year. But what I'm finding is that patients are asking me, so what does this mean? And that's probably the most common question that I get. So I'm going to review the labs and the lab values that are associated with normal ranges and some common approaches to addressing some issues that you might see with your lab values on these tests. And then, of course, as always, I do Dr. Tidman's tips and takeaways at the end, which should sound pretty familiar to you all. So again, this is the first in a 5-part series, and this video reviews the CBC and the CMP. So CBC stands for complete blood count. Some of the important markers that you'll see that are tested by a CBC include red blood cell counts, and on the screen you'll see some of the normal ranges for adult females, adult males, and children. And keep in mind that these normal ranges are just guidelines. Your ranges or your results may be a little different, and just because they're outside one of these ranges doesn't mean that there's necessarily a big problem. One of the things I caution my patients about is that any one of these markers needs to be confirmed with other markers that speak to a problem. So none of these are taken by themselves. White blood cells, and we know that white blood cells have a lot to do with immunity and fighting viruses and illnesses. They typically range from 5,000 to 10,000, so that's a pretty big range. But it's good to get these checked, especially if you have some chronic health conditions or seem to be sick all the time. Of course, hemoglobin is the protein in red blood cells that carries the oxygen to your cells and organs and other structures in the body. Typically, adult males are between 13.8 and 17.2, and adult females between 12.1 and 15.1. And of course, hemoglobin is very It's variable in terms of your age, and then in females, if you're heavily menstruating or if you're pregnant. So these are things that can affect your hemoglobin counts. Some people are diagnosed with anemia if these hemoglobin counts drop below these ranges. And causes of anemia are multitudes. So if you chronically have hemoglobin that's low or dropping, it's a good idea to get that checked. Hematocrit is the ratio of red blood cells to the total range of cells in your blood. And typically, males run from 41% to 50%, and females from 36% to 44%. Pretty big ranges, but this also tells you a little bit about whether you've got some internal bleeding or some other problem with your red blood cells. Many of you will know a little bit about platelets. Platelets are responsible for the clotting of blood. They're actually a marker that's taken into consideration along with other markers like fibrinogen that talk about how well is your blood clotting, or is your blood clotting too much? So there's really a balance that your blood needs to maintain. And here are some pretty typical or common ranges for platelets. So again, the purpose of a CBC is that abnormalities in more than one of these markers could indicate an infectious disease or an immune system problem, some kind of blood disorder if your platelets are really low, some clotting abnormalities, and some nutritional deficiencies. So in our low fat emphasis, low protein, low red meat over the last couple of decades, we have noticed some of these blood values are low or abnormal. Our bodies do need the right fuel. So a comprehensive metabolic panel is just that. It tests a number of different blood markers that really address your different organ systems. And on this slide and the next one, I've kind of indicated what these blood markers and values are connected to in terms of an organ in the body. So the first one, the alanine transaminase, or ALT, is a liver enzyme. And I'm noticing more people with elevated ALTs lately. So our livers are really taking a hit due to our diet, our lifestyle, and some of the environmental toxins that we're exposed to. Albumin is a protein marker, and it can let us know a little bit about your kidney health. Alkaline phosphatase, ALP, is a bone health marker. So I'm seeing more and more people with very low or very high ALPs, which taken together with other markers can tell me a little bit about bone health. The AST is the other liver marker that I look at a lot. So the ALT and the AST tell me a little bit about the state of your liver. And I like for these two values to be below 20, but I'll show you the normal range here in a minute. Bilirubin also is a liver marker. BUN has a lot to do with kidney health. BUN taken together with creatinine tells me a little bit more about your kidney health. Of course, blood calcium is connected to a lot of organ systems. It tells how your blood is conducting calcium, which may relate to bone health, even neurological health, and cardiac health. So calcium has a lot to do with a lot of functions. Carbon dioxide tells me a little bit about your electrolyte balance, as does chloride and potassium and sodium. Those things are telling me a lot about kidney health, kidney function, and nutrition. what I'm finding in this low salt focus that we've had for decades is many people kind of live with very low sodium levels. Our body was actually created to eat salt. Our ancestors preserved their food in salt when they didn't have refrigeration back then. So humans are used to eating a lot of salt. And unless you have a condition like salt sensitive hypertension, there's really no reason to limit your salt. It used to be that some studies showed that 2,000 milligrams of salt per day was the maximum, and now we're seeing studies that show that even up to 5,000 milligrams of salt is just fine with no health consequences. So, since everybody's different, I would suggest that you increase your salt and then check your blood pressure. See if there's any effect there. If there is, then back off on the salt. This is true also with potassium. Many people feel that they have to eat bananas to get their potassium, but I'm here to tell you that avocados have more potassium in them than bananas do, and they don't have all the sugar that bananas have. So there's other ways to get your potassium. There is a salt variety by Morton. It's called Light, Lite, salt, and that salt has added potassium. So if you're concerned about your potassium levels, I would suggest you add some Morton's Light salt to your daily diet. Of course, my big soapbox is glucose. So this is a snapshot on the CMP of what your glucose was at the time this blood level was drawn. So it may not correlate to a 3-month look back on your glucose, which is a hemoglobin A1C that I'll discuss in another one of these parts. But it's a snapshot of where was your fasting glucose on this particular day at this particular time. It does give me an idea of how you're doing with your glucose control. So these are some of the normal ranges that we use in Labwork to determine where you fall on these spectrums. And you can see the ALT and the AST have pretty large ranges. So again, as a metabolic health practitioner, I like for your ALT and AST to be below 20. On these normal ranges, you can see that they're up to 36 for ALT and 33 for AST. But if I see ALT and AST in the 30s, but I also see your bilirubin count is up and other liver markers are elevated, then I know that there's probably a problem with your liver. GGT is another liver test that can be run. So here's some normal ranges for some of the tests that I've discussed so far. And here's some more. There's a lot of them. Comprehensive or complete metabolic panel is pretty comprehensive. But remember we talked about creatinine, and that taken together with a BUN can show me more about what your kidney health is about. Here's your potassium and sodium, total bilirubin. Remember we talked about that being a liver marker. And then your total protein. And this is kind of an odd one. People with elevated proteins, then you wonder if the kidney's handling protein very well. So final tips and takeaways. How can I influence some of the levels that I've seen? Well, what if your hemoglobin is low? Maybe you're needing to eat more protein or meats with iron like beef. Maybe your sodium levels are low and your potassium's low, which often I see both of those together. So maybe you need to add some salt. So these are some of the tips and takeaways that are pretty common. If you've watched these before, you've seen them. So adopt a ketogenic lifestyle. Keep your fats at 60 to 70% of your daily calories, your proteins at 20 to 25%, but keep your carbohydrates low. And that means things in a box or a package with barcodes. You probably need to avoid those. Try to eat real food. Add some MCT or coconut oil each day, 3 to 5 tablespoons. We know that elevated ketones will reduce some of your inflammation, which affects these blood markers that I've talked about today. And of course, what's the best way to know how our body is dealing with what we eat? Well, it's to test your glucose and ketones every morning. That's the best way to tell. Your snapshot glucose reading on these tests may tell you what your glucose was that day. But in order to make some real changes, you need to test and track your glucose and ketones every morning. Try to do some kind of fasting protocol. Our bodies were created to fast. That's how our bodies clean up damaged cells, kind of recycle things. Our digestive system can rest. There's a lot of benefits to fasting. So if all you can do is a 16-8 fast where you eat 2 meals a day and fast overnight for 16 hours, that's great. Do that. If occasionally you can go to 1 meal a day for a day or two per week and do more like a 20 to 23 hour fast, that's even better. Of course, exercise. I'm all about exercise with a combination of aerobic and resistance training. And if all you can do is walk around your house, then do that. If you can start walking around your neighborhood, great. If you can start hiking, wonderful. But if you can, do some resistance training, some heavy lifting, and some aerobic training, that would be even better. Address your microbiome if you're having gut issues, because if you're not absorbing the calcium and minerals that you need, you're going to see changes on this blood test. Take vitamin D3 daily, between 2,000 and 5,000 IUs a day. I'm really finding that the majority of people in the United States are very vitamin D deficient. So if your vitamin D levels are under 30, then you need the 5,000 IUs per day. If your vitamin D levels are under 50, then you could probably do 2,000 IUs per day. If you have significantly deficient vitamin D with levels below 10, then you're going to need more like 10,000 IUs per day for a while. And again, here's my salt remedy. So take up to a half a teaspoon of salt daily in lemon water and try do a mixture of Morton's light salt plus Himalayan sea salt. You're going to be able to get some good potassium and sodium, but also some minerals that you need. Drink lots of water with the lemon and salt. The goal is to drink as many ounces of water per day as you weigh. So if you weigh 130 pounds, try to push to drink 130 ounces of water a day. I know, it's tough. And then I would suggest that you get your blood work done every 6 months. It's the best way to monitor your health and what's going on. If your doctor won't order it that frequently, there's some very low cost order your own labs, like Own Your Labs. I don't work for them, but very good prices on ordering your own blood work if you have a LabCorp nearby for your blood work. These are the references that I used for today's presentation. Thank you for stopping by and reviewing this Bloodwork 101 Part 1. I'll be posting the other parts of a 5-part series on Mondays. If you're interested in participating in one of my studies, here are the email addresses on the screen. I'd also be happy to answer any questions. Thanks again for stopping by. Please like, subscribe, and hit notifications. That'll help me out. And I'll see you in the next part of this video series.